Welcome to the State of Health. I'm your host, Karen Bowling, Cabinet Secretary of the West Virginia Department of Health and Human Resources. According to 2013 data from the Center for Disease Control and Prevention, West Virginia has the highest number of babies born suffering from drug withdrawal in the nation. So, what happens to these babies? Here's some disturbing video of an infant experiencing severe leg tremors as he goes through withdrawal at Cabell Huntington Hospital. Today, we'll talk about the people who have helped change NAS treatment practice in our state, including West Virginia Congressman Evan Jenkins. We begin with Dr. Sean Loudin, a neonatologist at Cabell Huntington Hospital. Dr. Loudin, thank you so much for being here.
Thank you for having me.
You know, going back to the video, I know it's very disturbing for individuals, and this was a young baby treated, and the baby's doing fine now. Yeah. But can you talk about a little bit about what you're seeing with babies coming into Cabell Huntington Hospital with this severe drug withdrawal?
So, you know, the babies do need our help. And any time that moms, do take any type of substance that does change brain chemicals during pregnancy, their babies are at risk for going through withdrawal. Opiates are by far and away sort of the main class of drugs that cause withdrawal, but many other substances, from nicotine, marijuana, and other even prescription medications, can affect babies while they are, inside of mom, and then when they are born, can definitely have withdrawal from those substances.
Now, I know that it's now sort of a diagnosis. How do you make that diagnosis? I mean, how do you sort of take all of the symptoms they're having? Because I'm sure there are times when babies are born and the mother's just not had any prenatal care. You don't know that the mother is taking drugs.
So, yeah, in fact, there's actually no way we can predict, even if we know that mom is taking drugs, about which babies are going to go through withdrawal and which ones aren't. So the important thing that healthcare providers need to know is that we do need to just simply observe all babies who are at risk, and then just pay attention to those kind of classic symptoms that babies will exhibit when they're going through withdrawal. So unfortunately, just like the video, tremors are kind of one of the main symptoms that babies will have whenever they're going through withdrawal. So if we see a baby who is having those tremors, in addition to some of the other things like sneezing and not feeding very well and diarrhea and some of those symptoms, if those symptoms are occurring in a baby, it should at least clue healthcare providers in that baby might be going through withdrawal. And at that point, we just need to keep watching that baby and identify those symptoms. And if they get bad enough, unfortunately, we may have to start treatment as well.
Now, I know you talk about, starting treatment with the drugs, various types of drugs. Mm-hmm. How do we go about ensuring the safety of the baby during that time, and what is it that we have to do, and how do we potentially engage the mother so that they understand what's happening as well?
I mean, I think it's all about education. And in the beginning, it is very difficult for mothers because, frankly, they're postpartum. And so there's a lot of hormonal changes that they go through, as well as emotional changes that they go through. But it is important that we do at least start to explain the process to them, tell them how their baby is different than a baby who hasn't been exposed to drugs, the changes that occurred, and so they understand the treatment and the sort of therapeutic environment that they need to be in and why that's important to their baby's care. So then that way, ultimately, we can get that baby better and home. And out of the hospital, or out of the healthcare facilities, and reunite the families as much as what we can.
I know this is I know you don't have a specific data point, but could you tell us how often you think you're seeing this at Cabell Huntington Hospital, babies born with neonatal abstinence syndrome?
So we see anywhere between 10 and 15% of all of our deliveries. So we're talking somewhere around 300 babies a year that are born at one facility in our state that are affected by drug withdrawal.
Wow. Is that something that you see more in a large hospital like Cabell Huntington, or could it be any hospital in the state of West Virginia?
I travel all over the state, and I go to many hospitals, and every hospital is affected. by drug withdrawal. Some places simply just don't have the resources that we have at Cabell to kind of have the system that we have in place. And it becomes very burdensome on those facilities to be able to kind of do the right thing by the baby and the families.
Now, generally, how long do these babies stay in the hospital? I mean, I know that's also, a factor as babies need the bonding and all the things that are really important to, that nurturing at the beginning of their life.
Yep. So, on average, our babies stay in the hospital approximately a month while they're sort of undergoing treatment. Well, first of all, while they're being identified, undergoing treatment, and then observing after treatment's over just to make sure that they're okay. But the problem is that there's a huge variation between the times that you can be in the hospital. Some babies can be out a lot sooner than 30 days, but then there are some who are in a lot longer than 30 days. And a lot of that does depend on the combination of substances that the baby is exposed to during pregnancy. So when you add a lot of substances, marijuana, benzodiazepines, even other prescription medications on top of some of these opiate medications, it can make the withdrawal extremely complicated and complex. And then it makes the healthcare workers sort of have to use a lot of different options to try to keep those babies comfortable as well as get them through their withdrawal process.
And, I'm sure you look at it holistically. I mean, you're having to deal with their entire environment. And, I know that you have been very actively involved in creating an alternative, which is what's called Lily's Place, which we're going to hear about during our show. Why is that alternative environment valuable for these babies?
So, a lot of people, focus on sort of the medication aspect of things, but the environment does play a huge role with these babies' care. So we want to have a quiet, sort of calm, low light, low noise, but a very caring environment for these babies to really get the best start to life that they can. And that's one of the things that we are focused on, at Lily's Place, as well as in the hospital. We kind of have that nice system of care that sort of wraps itself around the babies and the families to get them, the care that they deserve in a safe environment with skilled nursing, care as well as physician care and treatment.
Well, Dr. Loudin, I admire what you do, and I thank you for your dedication to the babies and the families in the state of West Virginia.
Thank you very much.
Still to come, we go inside one of our first centers in the country to deal with this issue and talk with one of its founding nurses. Stay with us.